Greetings from Galway. Thank you very much for the kind introduction. I'm Ronan Kavanagh, and I'm a rheumatologist based in Ireland. So what, might you ask, could Miles Davis, one of the greatest jazz performers of all time, have to do with this? Consultation between a doctor and his or her patient. I would argue a lot more than you might think. I've been a rheumatologist since 1998, and in addition to my rheumatology practice, I run a clinic tending to the musculoskeletal needs of musicians, and I've been around them my whole life. This is me in 1985 in a band I joined, and that's me bang in the middle there with a full head of hair. And at that time, I was a classically trained pianist. I'd studied all the exams. I'd studied music in high school. I could read sheet music. I understood the music and theory, and understood some things about composition, and I'd done all my relevant exams. And I thought I knew something. But my first day going into a room playing with these other really amazing, accomplished musicians, I found myself really struggling. I was having to play with other people, and to play and to listen at the same time. There was no sheet music. I had to learn how to speed up and slow down to play along with them. I had to learn to be attuned to non-verbal cues. And initially, I was quite wooden and self-conscious and not very good. And over time, although I confess I was never an amazing keyboard piano player and certainly not a soloist, I somehow managed, through practice and immersion with these guys, to become reasonably competent and add some value to the overall sound of the band. At the same time, in medical school, I was going through a similar transition, having studied the theory of medicine with the anatomy and physiology and biochemistry and pharmacology and so on, and also learnt off the medical scales and arpeggios of history, taking auscultation and percussion. I then had to transfer these technical skills and theoretical skills into a real-life higher stakes live environment. So I was trying to apply the theoretical information in me to a patient who might, for example, not want to play along with the sheet music version of the medicine I was trying to play, or who might want to play at a faster or slower pace in a different key, or even play a completely different piece of music medicine that they might not even be able to name. But in both instances, both in my musical life and in my medical life, I was beginning to learn about performance, that difficult trick of being able to harness theoretical and practical knowledge and put it into practical use in the service of an audience. Musicians do it, doctors do it, and it's a hurdle both musicians and doctors need to be able to do. And although at that stage I decided to largely abandon my musical career for one in medicine, I continued to do the medical equivalent of a touring musician, learning my chops on the road in rheumatology, eventually, playing hundreds of gigs with thousands of patients in different cities, building a large medical repertoire of rheumatology tunes, learning from my trainers and mentors, and my performance was being improved, and as my knowledge and clinical experience increased, so did my confidence. I learned all the standard rheumatology tunes. I learned the immunology, cytokines, how to get around a moody radiologist, deal with an anxious or angry patient, do it when I was tired, see around corners. I had the easy parts of the repertoire and the more complicated ones. Initially, the way I practiced, and this is true for doctors and musicians, I kind of copied and emulated mentors and trainers and heroes of mine. Sometimes after long exposure working with them for months or years, but sometimes even after short meetings. I learnt from their clinical knowledge, but also about their demeanour and how they related to patients, how they lived their lives, what worked and what didn't. And I was absorbing elements of style and a way of being. But eventually, it was time to leave the fold. And in 1998, here's me as a newly minted rheumatologist. Note the X-ray viewing box and the still full head of hair. At that stage, I had internalised most of the rheumatology back catalogue. I knew most of the tunes, or at least those ones for which evidence-based medicine sheet music was available. I was competent, perhaps a little bit more confident than I should have been, because I didn't realise that the hardest and possibly the most rewarding part of my rheumatologic development was to come. I just completed the first phase of my development as an expert, my apprenticeship, and was entering what Professor Roger Kneebone, who is a doctor and an expert on experts from all walks of life, is called the journeyman phase. And having mastered the fundamentals of our discipline, having learnt the theory, scales, arpeggios and standards, Kneebone argues that this isn't enough, and that the musicians and doctors and rheumatologists who have an impact are those who channel the theory, technique and ideas of their predecessors and reshape it through their own personalities, feelings and experiences. In musicians, this is known as developing or finding your voice, and it's strongly tied up with your clinical experience in medicine, but also strongly associated with your identity and personality. This is Yo-Yo Ma, who is probably the best known cello player in the world, and he was a child prodigy. This is him while he was still in university in Harvard in 1979, playing with the London Philharmonic. And even at that stage, where people might have perceived him as being at the top of his game, his mentor in Harvard, his name is Leon Kirchner, who's a conductor, often said to him that despite his technical accomplishments, that he still hadn't found his voice. And this is something that has developed in him over many years, through playing and experience, but also through musical exploration into different genres. He's a very self-reflective sort of a person, but also has a very clear and frequently revisited sense of purpose. Even if you don't know a lot about Miles Davis, his sound is instantly recognisable. Just one note from Miles and you know it's him. But it took him a long time to develop his trademark mid-range muted economical sound. When you hear it, you know it. I believe, and I think, Roger Kneebone does, that finding your voice as a doctor is one of the most underrated features. I think it's what makes us authentic and relatable as human beings who just happen to be doctors, looking after those human beings in our care who just happen to be patients. The other thing that Kneebone says that happens in this journeyman phase of expert development, both to musicians and doctors, is that as we become more experienced, based on increasingly refined and quicker pattern recognition and more learned technical skills, we have to think less about what we do, and what we do becomes more internalised and automatic. And this should allow a crucial shift to take place, whereby we're more able to concentrate and respond to the person in front of us, rather than our own thoughts on what we're doing, and whether this is a musical audience or an audience of one in a patient encounter. Or at least that's what should happen. But of course, it takes more than one voice to have a conversation. And this moves on to the next phase of our musical development, that in medicine, of course, is the ability to improvise. And one of the things we learn in rheumatology, of course, is that not everyone fits into the nice linear pattern of a textbook. Patients often deviate from biomedical patterns of illness. So we kind of need to be able to relax and accommodate for this. We need to know when to push and when to back off. We need to know when to be quiet and when to speak. And we need to choose treatment options where the evidence isn't there to guide us. We're constantly improvising and adapting our practice to the individual in front of us. And I believe that improvisation is at the heart of patient-centred medicine. To do it well, there are no shortcuts. You have to know all the tunes and have internalised them. But at the heart of improvisation in jazz and in medicine is conversation and listening with all of our senses to verbal and non-verbal cues, and then responding and accommodating. Where it's done well, it can be difficult to discern the voice of the soloist from the others in the room. Of course, one of the things that postgraduate medicine does very well is update us on the science of our rapidly evolving specialty, with meetings like this and ACR and EULAR. But how do you know if you're performing well as a doctor? Atul Gawande thinks the answer might be through the use of coaches. And spurred on by the observation that certain elite musicians, for example Ishtak Perlman and Rennie Fleming, who are at the absolute top of their game have had lifelong coaches. And if you think about even professional sports, professional tennis players will have coaches their whole lives. He decided in mid-career to bring in a coach in the form of an old boss and mentor to observe him and provide feedback to his performance. And it transformed his practice. So, seeing as Atul Gawande wasn't available, I got my good friend and lifelong rheumatology mentor, Dr. Maurice Barry, to come along and observe me in my practice. And I have to say, this is possibly the most important professional development event of my career. And he sat with me for a day in my office, watched me seeing patients. And I don't have time to go into everything that he fed back to me, but there were lots of technical things, some tips on preparing better for my clinics, which meant I could be more present and less distracted. But the most fundamentally important thing that he observed related to how I was underusing a really important tool in my consultation, and that's creating space. You do a lot of talking, you know, he said to me, which is certainly true. And it's kind of partly, I think, an effort to keep things moving along in a busy clinic. I'm naturally talkative. It's partly nervousness, I think, but also, truth be told, it's an effort to try and control the consultation at its pace. The net effect of this is it leaves no pauses or gaps. And Maurice, who's not really a jazz musician, he tells me his favourite album is Bruce Springsteen's Nebraska, was talking about what jazz musicians call creating space. Dr. Paul Heddy's landmark 2007 essay called Jazz and the Art of Medicine, Paul talks about when he's in a room with the patient, he tries to be like Miles Davis. So this is a clip of Miles Davis from his album Kind of Blue. So Miles, it is said, lacked the technical skills to play like other trumpeters of his era, like Dizzy Gillespie and Fats Navarro. But his brilliance manifested itself not so much in what he played, but in what he didn't play. His solo voice leads you to hear the sum total of the music and not just him way out front. He doesn't play a lot of notes, he just plays the right ones. And as Maurice said to me, you've got to make time for pauses. And when? I thought, when can I do that? I'm busy, I've got to kind of keep things moving here. He said, look, when you're washing your hands, be quiet. When you're checking their blood pressure, stop talking, or even when you're auscultating. And why? Because it allows our patients time to pause and reflect and work out what they want to say next and express themselves. But it also allows us as doctors to pause and reflect before reflexly jumping into making a decision. Although our specialty is seen as something which is deeply informed by science, its delivery at its heart is a deeply creative process with many parallels in music and musicianship. And it's kind of understandable that early on in our careers the focus is quite rightly on the acquisition of knowledge, and that initial focus is really on what we know and what we can do, but not on who we are and how we work best. I think it takes some confidence and insight to pull back our focus and see ourselves as the performance we are. But what about taking it to the next level? How do we do that? Having had a small taste of the transformative power of coaching, I wonder if elite musicians are onto something here, and maybe we could learn more than we think from other performers. Why don't you give it a try?